Good evening. Today is Friday, April 9, 2021, here in Davao City, Philippines. I am Ace Perez, and welcome to the Talking Heads, where we discuss current and relevant issues in our community straight from the news sources. Following the slight increase of COVID-19 cases in Davao City, the IATF has now classified the city as a low-risk area from last week's minimal risk area. Meanwhile, the Department of Health, or DOH, on Thursday, April 8, adopted the recommendation of the Food and Drug Administration, or FDA, to suspend the use of AstraZeneca vaccine for adults below 60 years old in the wake of reports linking it to blood clots and low platelet count. And to discuss all of these, we are joined tonight live by Dr. Ashley Lopez, the acting head of the Davao City Health Office. Maayong gabi, Doc, and welcome to the Talking Heads.
Hello, good evening, everyone.
Daghang kayong salamat, Doc, for granting this interview. We know that you're very busy, but you still granted this interview. Now, to start the ball rolling, Doc, we are already over a year since we started our fight against COVID-19. And just this week, the IATF classified Davao City as a low-risk area from minimal risk area. So how would you describe generally the COVID-19 situation in the city after a year into the pandemic?
In Davao City, we do LGU risk assessment every week, no? So the risk classification of low risk was based on the past week, which is actually morbidity week 12, wherein we post several cases in several barangays, no, in Davao City. That's why we were classified under low risk. But lately, it's either minimal or low risk. No? So far, if I remember it right, the first COVID case we have in Davao City was way back in March 15, 2020, affecting a 21-year-old male. And nagkaroon po tayo ng surge right after Manila and Cebu in October, when we had the first surge happened, and it went on up to the middle of December, and after which medyo bumaba tayo ng konti, but because of the post-holiday surge, we had also one of the highest reported cases for Davao City in as early as first to second week of January. And thereon, pagdating ng February or late January, we have slowly seen the downtrending of cases in Davao. So far, so good. We have relatively low cases, and we were able to sustain a minimum number of cases for Davao City, and we're still trying to get it as low as possible.
Doc, a lot has happened over a year about our COVID-19 situation in the city, but what do you think drive the cases down in Davao? And do you think the intensified contact tracing or surveillance on the residents helped a lot in bringing our cases down here in the city?
Yes, basically it's a holistic effort, no? Hindi pwedeng government lang involved, hindi rin pwedeng security lang involved o health lang involved. It has to have the cooperation and the participation of everybody, including the private sectors. First and foremost, if you're going to deal with this kind of pandemic, no, an overwhelming pandemic like this COVID-19, kinahanglan na gyud kay ma-establish nga a good governing body, which in our case we were able to organize what we call the Davao City Task Force, because that will be the one to manage everything. So unfortunately for Davao City, it was spearheaded by no less than our city mayor, Inday Sara Duterte. So as early as the beginning, since the beginning of the start of the COVID cases in Davao City, we were able to form immediately the COVID-19 task force, no?
Mhm.
And it has developed into a very, very strong uh, managing committee, no? A managing group, which is headed no other than by our city mayor. So, pagkaroon po ito ng mga clusters, like we have the what we call the response cluster, and under the response cluster, we were able to develop also what we call the operation center or the OPSEN, including our call takings, no, our telemedicines, and including the part of the reintegration is the yung counseling, because psychosocial counseling plays an important part, especially on the aspect of reintegration of those post infection patients going back to the community. And right now we have added up the vaccine cluster in the middle of the vaccination we have in the country. And the other and the last but not the least, we have the recovery cluster, no, which is also being made up of several government agencies that handles the recovery cluster, particularly yung ating Davao City Investment and Promotions Office. So basically, we are not doing anything special, no. Gisunod lang namo kung unsay recommendation sa Department of Health, which is very basic, no, yung ating PDITR, from the prevention aspect down to the testing or the diagnosis, isolation, the treatment, the contact tracing, including the integration. Kung i-follow lang nato ning sequence, no, or a process of how to manage COVID-19, I think there will be no problem. But the most important thing is we have the leadership of the LGU to spearhead everything. And it should be in coordination with our private sector, the community, including our barangays, and all the citizens, no? Those all sectors that are involved. So kinahanglan maguni siya, magtinamaganay, dili pwedeng isa lang ka sektor, dili pwedeng duha lang. All should have the should share their part, no? So that we could come up with a good response to this pandemic. And that's what happens in Davao City.
Yes. And Doc, one of the good things or one of the things that the city is doing for the past months is this contact tracing or the surveillance of residents. And what do you think are the root causes of the clustering of cases here in the city? Ano yung common reasons?
Same reason with the other provinces or cities, no. Basically pag naa kay usa ka tawo, especially those coming from exposed to a workplace, then maguli og balay, siyempre exposed po ang mga household members. Then talking with friends, with other relatives or mga kapitbahay, so a tendency is if one would be able to transmit the disease in a particular community, then slowly this particular area mudaghan gyud ang kaso because of the easy mode of transmission of COVID-19. So basically yung ating ginatawag na mass gathering, no? Yung ating crowding. Kaya nga we are continually trying to push for the implementation of the social distancing, because among the basic health protocols that important to be sustained is yung ating local distancing, because as you know, COVID-19 is a respiratory disease, no. Although this is viral, but the mode of transmission is through your mouth or nose, no. By coughing, sneezing, no, pag-atsing, pag-ubo, pag-istorya, even for laughing or singing, you can transmit it. So that is the most and the easiest way to transmit a disease to other people. And that's why it's very, very easy to transmit, lalo na if you have an index case in a particular community. without observing any of those basic health protocols, kurot gina.
Mm.
Akuan
Basically, Doc,
matakpan gina.
what you're saying is there's still a need to be vigilant when it comes to the COVID situation in the city, and the public should not be complacent when it comes to like meeting their friends and families. So there's still a need to practice the minimum health protocols. Now, Doc, let's move on to the recent news about AstraZeneca. The DOH adopted the recommendation of FDA, or the Food and Drug Administration, on the halting or suspension of using AstraZeneca vaccine to individuals below 60 years old because of reports of blood clots and low platelet counts. Now, in Davao City, Doc, we would like to know, do we still have a remaining supply of AstraZeneca vaccine, and how are the individuals inoculated or vaccinated with AstraZeneca doing as of the moment?
The first and only allocation that we received out of
Mm-hmm.
this AstraZeneca vaccine was about 2,000 shots. Uh, and of these 2,000 shots, siyempre, divided by 2 mayan because we have to save the half for the second dose. So roughly we were able to vaccinate around or inoculate around 1,000 recipients of the AstraZeneca. That includes me. Okay,
Mm-hmm.
but that is the first and only delivery that we received from the national government using the AstraZeneca, and so far wala man kaming mga reported severe cases, just like what happened in other countries such as Germany when they had incidences of thrombosis and uh, yung what we call these blood clots. No? So far, even in the whole country, in the Philippines, we have no reported cases of blood clots or thrombosis. Sa Davao naman, mild lang, although common. We expect to have those yung post-injection ng mga fever, pain and injection site, which are very, very mild adverse effects. But to severe adverse effects, there were so far no reported cases having severe adverse effects using the AstraZeneca. So unfortunately, ano kasi, siyempre we have to be scientific, and according to the FDA head, which Dr. Domingo, no, merong several, I think that's about 16 cases reported. Recently lang, we have 16 reported cases of those people or recipients of AstraZeneca who had incidences of blood clots or thrombosis. That's why the government decided to hold it, but it's only temporary because right now I think there's still an ongoing further study or research on the feasibility
Doc,
of AstraZeneca vaccine.
you mentioned about 16 individuals. Sa Pilipinas ba ni siya nga nahitabo, or
We have no incidents of
okay,
blood clots or
just for
thrombosis
clarification?
in the Philippines. So the report were coming from other countries. Ang atin lang, we have to be cautious because even in one case we have to be conscious with that. Kay what siyempre the government will be liable for that if we're going to have those incidences, no. Considering that there are already reports outside this country, so we have to be cautious as much as possible. That's why we are waiting for clearance. No, it doesn't mean that it was stopped. It will not push through for the second dose. We cannot say it yet, no, unless there's going to be clearance that will be released by the Department of Health, including the FDA.
Okay, so currently you're still waiting for advisory from the central office with regards to
Yes.
the remaining supply of
Kay
AstraZeneca.
temporary lang man temporary. This is only temporary. And we're praying and hoping that this will not come to an extent na ma-cancel yung ating AstraZeneca because we have a lot of recipients already who received the first dose. Sayang naman.
All right. So, Doc, from one vaccine to another, let's talk about Sinovac because the Vaccine Expert Panel or VEP has approved the recommendation to administer the Sinovac vaccine to adults age 60 years old and above. Now, in Davao City, did we already start administering Sinovac vaccine to our senior citizens? Nagsugod na ba
Uh,
tayo?
Sorry to say, no, we have not yet started our inoculation for our group ADAS 2, which is
Mm-mm.
for senior citizens, because we have more or less around 22,000 frontline here healthcare workers in Davao City, and with the limited allocation of Sinovac, uh, wala pa namo na human ang tanan ng mga healthcare workers. That is actually on the top of the priority list to be given these vaccines, no. But we're on track. Ongoing naman po yung vaccines. We have received uh, the latest allocation coming from the 1 million doses that was purchased by the national government from China. So meron kaming several, but it is limited, as we know. It's because of what is happening in NCR Plus and Visayas and Cebu provinces. So kailangan i-priority nila yun. That's why siguro majority of the allocation of the Sinovac that was purchased were given to those places to as a priority. So gamay lang ang among nadawat, but we're going to maximize. In fact, the other day I think we have received around 610 vials only of Sinovac, the new batch, and naa pa may nabilin nga mga 300 plus that will be used for our Monday's regular vaccination day.
Mm-mm. To date, Doc, pila na ba ang mga frontliners na nabakunahan na with Sinovac and AstraZeneca? Total.
As far as I know, there are already more than 13,000 healthcare workers that were inoculated.
Mm-mm.
But we still have to finish, no? Kasi yung aming under Group A, we still have to deal with mga standalone clinics, infirmaries, including mga lying-ins, paanakan, at saka yung mga medical or healthcare workers that are working as private. So, ginamap up na lang po namin yung natitirang healthcare workers before we can proceed with the Group A2, which are the senior citizens. But hopefully, before the month ends. And another factor would be the availability of the vaccines. No? Kung hindi lang sana wala lang sanang interruption sa delivery ng vaccines for Davao, then we can continuously roll out vaccines including sa atong mga senior citizens.
Doc, on those included sa priority list, specifically frontline workers, are there reports of refusal, and can you share what are their reasons of refusing of getting the vaccine?
Very, very minimal yung refusal, no. In fact, I can only count it using my fingers, no. Because basically before the start of the inoculation, we have assured that information dissemination, including the giving out of the basic true facts about these vaccines, no, were being relayed to our constituents, no, na we were able to educate them, no. So massive po yung aming information campaign. So most of our constituents were somehow knowledgeable of the true and the factual informations about our vaccine. So fortunately naman na majority of our healthcare workers submitted, no, for inoculation. So we have no problem so much with the refusal.
All right. That's a good sign, Doc. Now, you mentioned about over 13,000 health workers already vaccinated here in Davao City. Included na ba diri Doc kaning mga frontliners nato na located in the far-flung or outskirts sa city like Marilog, Kalinan, etc. Dira na mga lugar? Apil na ba sila sa list or apil na ba sila
Yes,
ni nga
yes, definitely, because we do not, ang basis naman ng pagbakuna is not on the location, no? It is based on the groups, no? Priority groups, we have under A1, meron tayong subgroups, no? So hospitals, clinics, those working health workers working in the government, no? So pag sinabi mong those health workers working in the government, so that involves everyone, including those in the bukid or the far-flung areas. So dili na siya mag-depend sa lugar. It will depend on the subgroups where they belong.
Okay. Now, Doc, on this issue, this has been confirmed by Davao City Mayor Sara Duterte Carpio herself that there have been reports about people jumping the vaccination line. So, what is being done to address this issue, specifically here sa ato ang city, in terms of
So far, it has not been an issue with Davao City because we are following the priority listing. So far, wala namang issue na ganun na reported. In fact, when at the start of the launching or the ceremonial opening of this vaccination, no, nakita naman natin si Dr. Rick Audan talagang nauna doon. I was expecting na ako doktor na ako, but I'm not from SPMC, but I was expecting that I would be included in the first health workers to be inoculated. Pero I was advised na dili man gud ka taga SPMC doc, so dili sa ka maghuwat ka sa imong turn. So that's how strict we are in administering our vaccines because we strictly follow the priority listing. So ako nauna ko among the public health workers, no, kay nauna magod in March, way back I think it's in March 5 wherein we have the ceremonial launching sa SPMC. So sa public naman sa City Health Office, the launching was done in I think March 11 or March 12. That's a week after SPMC. So doon ako nabakunahan. So so far ano naman, it's we are following the priority listing and we have not been patronizing or following those mga illegal activities like yung jumping.
But in the event, Doc, na natay masakpan na or we have reports about this jumping the vaccination line in the event na masakpan sila, do we have sanctions or any suspensions about these people masakpan nga mag-jump sila sa vaccination line? Nabatay sanctions for them prepared?
We have known naman that the president addressed this mga jumpers, no? And I think everyone acknowledged the importance of following the priority listing. So far wala man tay balaod ana, so we cannot penalize everyone, but if it's going to involve government officials, then there are rules, no, under the I think the policies under the policies that was set for the government officials and government employees. But for now, wala man ko yung nahibawan penalty for jumpers. But as far as the IITF guidelines, siguro baka meron tayong mas-cite dyan that would penalize anyone who's illegally engaging into the COVID-19 vaccination.
Okay. Doc, for COVID-19, you mentioned about, in a previous interview, separate interview, you mentioned about their COVID-19 non-believers and misinformation has been a challenge in our COVID-19 response. So what is the city doing to address this very challenging problem, no, when it comes to our response sa COVID-19? Mga non-believers and misinformation.
Sa kasabihan nga, pag pinukol ka ng bato, gantihan mo ng tinapay, no? So probably that is the approach, no. These are very small part of the chunk. Gamay ra na sila nga dili mo tuo. All what the efforts of the government is yun pa rin, just to intensify our information campaign, no? Educate everyone. In fact, sa aming OPSEN, we have the call takers and the telemedicine that would answer all those queries and questions on the myths and misconception, even the false claims about COVID-19. So as much as possible, we are trying to address, no. Even in my talks sa mga conferences or sa media, I'm also trying to address to everyone that COVID-19 is real, and those other leaders. So all over the country, all over the world, we're trying to educate everyone, no, that hindi ito dili ni siya dula-dula, tinuod ni siya, no, na virus nga hatag og sakit dili sa kalibutan kaning COVID-19, no? So hindi ito gawa-gawa ng gobyerno o hindi ito haka-haka, no. So we have to do away with those false claims and educate those people. Yun lang naman dapat lang natin sila tagaan og right information, educate them so that eventually they would realize yung sa kanilang belief on what is really COVID-19. And if you see the situation right now, there are millions of people who are affected, no? No? Lalo na doon sa mga epicenters, no, in the US, in Brazil, and even in the Philippines. So what is happening right now in NCR and Cebu provinces, no, where many people are affected, many people died, no, and with the onset of this new COVID variants, no, na lalong lumala yung sitwasyon because of the mutations. These are actually normal, regular cycles that you see in a virus, no? Not only COVID-19, no, even in flu, in other viruses, meron tayong tinatawag na mutation, and it's been going on every 2-3 weeks meron talagang mutations na nangyayari. And unfortunately, we have this mga significant variants that causes more severe cases of COVID-19 infections. So daghan na apektuhan. You would realize that not only in sickness, no, but economically. So ang development ng mga syudad, ng mga countries were compromised because of what is happening, because of this pandemic. And I cannot imagine why there are people who does not believe on COVID-19.
Okay. Speaking of mutation of COVID-19 or the virus itself, Doc, how's the biosurveillance monitoring with regards to the new COVID-19 variant? Are we still sending specimens to the RITM in Manila for genomic sequencing? Padayon ba gihapon taan ni Doc?
Yes, naamangguntay ka ng molecular lab. So those who are going to benefit from the biosurveillance that are those cities or provinces that are doing testing, particularly RT-PCR testing, because the samples that are sent to Manila are those coming from the RT-PCR testings, yung mga specimen. So continuously nagpadala ta every week at the DOH-11 is submitting, no, or sending the samples. Ang ginapasend nato ana sa atong Philippine Genome Center are those positive cases. So what is the process, no? Identify the positive, save the samples. Yung mga positive would undergo what we call the cycle threshold, no? So yung cycle threshold that will determine kung kinsa tong mga ipadala nga sample sa Manila, because as part of the requirement, those cycle threshold that are 30 or less So pag ang cycle threshold ng isang specimen, positive confirmed specimen would be, for example, 25. Uy,
Mm.
mataas yun. So, I mean, in by value, mababa yun. Pero ang significance nun sa CT value is ano yun, severe yun. So, these cases who have CT threshold or cycle threshold of 30 or less are being sent to Manila. So, it is being sent to Philippine Genome Center in Quezon City, wherein it will be undergoing a process to determine new variants. So, ang pagproseso will take about mga at least 2 to 3 weeks. Then, the Epidemiologic Bureau of Manila will send the results to Davao region. So, that's the time we know kung naatay new variants among those positive cases that were submitted. So far, for Davao City, naatay duha ka nakasulod nga variant under UK variant, no, or the B112. Kaso lang napugna nato, no, katong isang case bata, ang isa ka case adult, pero katong last case nato is an OFW coming from UAE in Dubai. Nag-retire na ni Uli og Davao, but she was detected positive in Manila, and it turned out a new variant, pero na-quarantine siya sa Manila. So when she got home, she was already fully recovered. So wala tay any signs of transmission or any signs of spread of the new COVID variants as of now. And we're hoping and praying na dili makasulod. That's why naningkamot yun na, particularly our security sector, to have strict monitoring, especially on our borders, no, in among our land, sea, and air travels. Kay hindi na to gusto nga makasulod ning tong new COVID variants, because once there's 1 or 2 or 3 that would be able to come in to this city, then it will explode, no? So that is the sequence. That's what happened in Manila and Cebu. So although naatay trend, that was the trend before the surge in Davao City, no, what ang affected nga cities were Manila, then it went down to Cebu before it went down to Davao. So hinauton ta with this new COVID variant incidents, it will not happen, no, the same way, because God forbids, no, kung may tabo na, then we're going to have another surge.
It's a good thing that we were able to bar the local transmission of this new variant of COVID-19. But what is the city doing, or do we have plans in place with a possible surge of cases due to our intensified COVID-19 case surge within the community? So nabatay mga plans na set and in anticipating for this resurgence or surge of COVID-19 cases.
One good trait we have in Davao City is yung the initiative ng ating mga liderato. Special mention natin si Mayor Inday Sara Duterte. She's very, very supportive. She's leading the way, no, on our mitigations, no, from meetings to plannings to executions, implementations of all the possible mitigation measures that is needed to be provided for Davao City. Ginahimo na namo under the COVID-19 task force. And for now, we have about a little more than 300 active cases in Davao out of the 13,000 plus total cases since the start of this pandemic in March 15 of 2020. Out of these 13,000, I think there's only about a little more than 2% active cases, and this comprise the 318 cases, if I'm not mistaken, active cases for Davao. Dili pagita makontento ana, no? Even the mayor is not contented. Dapat ubusin natin yan. We have to, although isolated na ni silang 318, they were already in facilities, no? Hospitals and facilities. PPMFs. But we have to do more contact tracings so that yung mga transmission nitong 380 na ito, ma-catch up natin. Not only with the direct contacts, but also those second and third generations. That's why the mayor released another executive order. The most recent was the Executive Order 20, wherein there is a mandatory testing of all close contacts that involves not only F1 but F2 and F3. Kasi with the IATF guidelines po natin, what is applicable for mandatory testing is only for F1. Yung F2, F3 natin, ginamonitor lang na sila. Once they develop symptoms, and that's the time they're going to be swabbed. On the other hand, if the F2 turns out to be positive after the presentation of symptoms, then he gets or she gets isolated. Same thing with the F3. But with this Executive Order 20, all F2s, F3, whether asymptomatic or symptomatic, kinahanglan gina sila maswab tanan. That's what we are doing right now. And on top of that, we have also launched or implemented what we call the intensified surveillance, heightened surveillance and response for COVID-19, related to yung mga influenza-like symptoms at saka acute respiratory symptoms. So we have three aspects of surveillance. One is yung ating community surveillance, then we have the facility surveillance yung sa mga, because we're putting up surveillance units among our health centers, district health centers. And the third one is surveillance on offices and establishments. So tatlong type ng surveillance yan, and we're doing it so that lahat po ng merong mga symptoms that are related to ILI or acute respiratory infections, and even COVID-19 related symptoms, then we have to test them as much as possible. And the government is trying to subsidize the testing, and that's why it's been offered for free to those who submit themselves for testing.
All right, Doc. With the recently released executive order by Mayor Inday, you mentioned about mandatory swab testing to all close contacts. But how's the testing capacity of the city as of the moment? And did we increase our testing capacity? So kumusta ang ato ang labs nato, Doc, here in the city?
From the average 400 to 500 testings per day, the target right now is to have at least 1,000 testing per day.
Okay.
Yun po yung aming target. And since earlier this week, we were able to I think the other day, we were able to test around 1,490 plus testing for a single day. And yesterday, we were able to test around almost 1,000. Very close to 1,000. So, and it's been going on because ganiha, our cluster members that are assigned for offices and establishments we're doing also sa surveillance swabbing to several facilities. So we expect another 1,000 testing for today. So if we continue to do this, then we may overcome all those possible cases that are still outside, because as I said, the ultimate goal for this massive testing and intensified surveillance is to zero in COVID cases in Davao City. That's what we were trying to and hoping and praying to accomplish, with or without the vaccine. Ever since the beginning, the mayor is not dependent on the vaccine, no? Because the vaccine will not totally protect the person or the community against COVID. O pag mabakunahan ka, probably you'll just have a less severe illness, but you still get infections, no? And the second intention of vaccine is to develop herd immunity. Kung maka-establish ka ng 70% coverage, no? But how can we be assured na mabakunahan ng 70%? So we will not wait for that to happen, because if we won't do anything, mudagan lang gihapon ng kaso sa COVID sa Davao City. That's why we are not sitting down, no? Even in just like now, holiday or weekends, no, we're not resting. We'll continue working, and with these 300 cases, although it's low compared to the other cities and provinces, no, we will not lax, no. We have to do all our efforts, no, para ma-reduce pa na to further, and if possible ma-zero in na to, because that is the main objective of the mayor, no. So kung mo-cooperate lang ang tanan and the people will participate on this campaign, no, kamo lang gyapon nagbenepisyo ani. So we have to work hand in hand.
Yes, it's good. It's good, Doc, that you point out about people not to be dependent no on vaccines. Kaya ang uban pod na misconception about vaccines na kung mabakunahan na murag immune na gid sila sa virus. So that's not really the case, no. Doc, thank you so much for your information and insights about the COVID-19. Now, before we end our program, let's move on to non-COVID-19 concerns in our city. How are we doing, or kumusta ang vaccination program against polio and measles diri sa Davao City?
Okay. Although it wasn't still on my term, because yung nahuman ang mass immunization sa measles, I was still not in the main city health office. I was handling the Davao Chest Center. But anyway, in summary, I think the city got below 90% coverage on the MR Asia. Yung just the recent mass immunization ng measles. Mataas naman, no, compared to other regions, no. Okay naman yung performance ng Davao City, but we have not reached the target, because the target for the MR is yung 95%. Unfortunately, Davao City by average has not reached 95%. So, but I think we're crafting additional plans, no, on how to continue, so that we could come up with the targeted rate for our vaccination against polio and measles.
Is it safe to say, Doc, that by the end of the year we can achieve or reach that 95% in terms of this vaccination against polio?
Well, hindi naman yan imposible, because we have the efficient naman yung ating coordinators sa city, no. So siguro konting push lang, no? In the middle of COVID-19, we should not compromise other programs, no. Particularly polio and measles program, immunization program natin in general. So I am advising them to continually focus on other programs, no, in spite of having this COVID-19 problem.
So what are your message, Doc, to the parents when it comes to the vaccination or immunization against polio and measles, to the parents na naminaw karon na nagtanaw karon sa tuong live?
Ayaw mo kahadlok og kanang duol sa inyo or to sa inyong mga health centers, no. What is important is you follow the basic health protocols that are required, no. So always be careful, comply with the basic health protocols such as yung social distancing, yung ating pag-wear ng mask, compliance natin on wearing mask and face shields, yung ating yung ating self-hygiene, no, by frequently hand washing at saka yung paggamit ng alcohol. So these are very, very basic but very important ways so that we could prevent COVID-19 transmission. Rest assured that the health centers in Davao City would continue serving, no, all those services, particularly sa immunizations, because we recognize the importance and the significance of immunization, especially among children.
All right. Thank you so much. That's Dr. Ashley Lopez, the acting head of the Davao City Health Office. May gabi, Doc, and salamat kayo.
May gabi og salamat and stay safe, everyone.
All right, again, that's Doc Ashley Lopez, the acting head of Davao City Health Office. To check for more stories, visit our website, www.sunstar.com.ph/Davao. Subscribe on our YouTube channel and follow our social media accounts on Facebook, Instagram, and Twitter. And that's it for this pilot episode of The Talking Heads. Good evening and stay safe.